So good morning, ladies and gentlemen. Let me say that I'm pleased and honored to attend this conference of distinguished guests and Greek friends, I must say as a Frenchman. It's really always a pleasure to be here. Let me introduce myself very quickly. I work for General Electric company, so we are the diagnostics company here in terms of imaging. We are a small part of this industry, smaller than Pharma. I'm not going to, I was thinking of how I should address the subject that we put on the screen here. I'm not a physician. I'm not going to walk you through a corporate presentation. I'd like to give you the feedback of a solutions practitioner with clients on where the data analytics subject is taking us and how we are learning along the way. So, to make things simple, from BI to AI, from business intelligence, which is something we've been talking about in the industry for a while, to artificial intelligence, I'm going to try to open doors, define terms that will help us understand how, as an industry, we are moving along this transformation, this digital transformation of the healthcare industry, with, in line of sight, more productivity, better quality of care, and better connectivity of patients and clinicians. So, every company has this type of page. The future is here, but we don't really know what the future is about. So it's about great images, it's about connectivity, but what do we do and what do our clients, the practitioners, the patients, the administrators, the payers, the government, the policymakers do out of it? This is still very much unknown, and this is a journey I'd like to take you on in the 13 minutes that I have left in this slot. So a few words about General Electric company when it comes to healthcare. We are in the therapy solutions. We are in the bioprocesses business from a manufacturing standpoint. We also are in the access solutions for healthcare in the hospital environment and the integrated solutions with the focus on diagnostic imaging, with in line of sight the patient first and the patient last, I was going to say, because the patient comes into a facility and leaves a facility. And the overarching goal here is to make the technology productive in terms of experience for the patient and for the users. Oops. So how do we see this in terms of building blocks? We are a technology company, so our business is to have engineers who are building technology with more clinical applications for the physicians. Now, we recognize the need for more connectivity, so the company is embarking into a digital journey that is well beyond healthcare to connect the various stakeholders of the industry. Now, once you connect, the idea is to make sense of the data that you work with, and this is the subject of today. So I'm going to try to give you examples of what we are doing today with our clients and where we think we are going, especially in the next few years. So in terms of data analytics, we're trying to make them smart or intelligent. So we look at asset performance. So we're going to look at an MR and see how we can make an MR more productive. We look at, if you look at the CT scanner dose, the X-ray dose of the scanner, and we measure that dose, and we try to manage that dose with our clients to improve protocol. And we're doing that with Afidea in Europe, in Greece and in Europe, for example. We're also looking at the hospital space. And with clients like Johns Hopkins in the US, we are mapping their hospital environment from emergency to the time the patient leaves the hospital to help bring productivity real time into the facility. So we talk about the health twin. You see this word here, word on analytics, health twin. So I'd like to crack the code on what would mean by health twin, because this is the essence of what we are trying to do in data analytics. You look at health twin in three ways. You look at the asset. We are a company managing assets, manufacturing and managing assets. We do aircraft engines, we do turbines, and we do MRIs. When you do the twin of an aircraft engine, you essentially mirror with data, real time, the activity of an aircraft engine. No people, just an engine. The people are in the plane, so you look at the engine only. When you look at healthcare, you don't only look at an engine. You look at a machine with a patient inside and with an ecosystem. So the purpose of the twin, which is to mirror an activity, when you look at healthcare, is not only about machines, it's about machine and people and processes around them. Now, aspirationally, over the next 20 years, we might think of the twin of a patient. How do we mirror the activity of a patient? And this is where it takes us to artificial intelligence, and I'll do the transitioning between business and artificial intelligence. Now, business intelligence, when you look at the twin, if you look at a machine, you want a real-time representation of what the machine is bringing in terms of data. It helps the service engineer improve the activity. It helps you simulate the impact of change. It also helps you monitor the patient into the when When you look at an ecosystem, then you look at the bottlenecks of the patient and the physician and the administrator and the nurse on the pathway, and you're trying to map this to bring productivity and to facilitate the care. Now, when it comes to patient, I would say it's more in the world of pharma. You look at therapy control, you look at anticipation through diagnostic of the therapy. Now, in the world of radiology, which is in a simple world, if you will, because everything is around a machine and people, it's much more simple than a hospital environment. What we are trying to do today is to extract all data available in our systems, which have not been used so far, and these are protocol data, time of exam data, to make sense of it and to render this data to the operator to help them improve their efficiency. And the idea of efficiency is to bring more care. It's not just to cut costs, right? What you see here is you have machine data. We look at managing the machine through asset management. We pull data from information systems because the radiology information system, the hospital information system, the PACS also bring data. And the idea is to mirror this real time to help the operator better provide the care. If you put this back into a workflow, not in a circle, into a workflow, if you look at imaging, you start from appropriateness, you look at the request, then acquisition, report, and collaboration. And again, the twin is going to mirror that pathway to help the vendor and the operator bring and make sense of data. When it comes to the hospital space, we call it wall of analytics, and I'll get back to you on this at the end of this presentation. I'll show you in a video what a customer thinks about this. And it takes us to artificial intelligence, because if you go back to this pathway, you make sense of data along the pathway, you cure the data, but then if you want data to be self-smart, this is where the algorithm, this is where artificial intelligence kicks in to accelerate the processing of data, not creating dashboards real time that helps you describe what you do, possibly predict a little bit, but not prescribe what you do. So the whole name of the game between business intelligence and artificial intelligence is to move from description to prediction to prescription of the healthcare business. Now, when it comes to artificial intelligence, I think we need to know what we are talking about, and there are several terms that people use undifferentiately, and they are different. Artificial intelligence is the ability of a machine to mimic, like we said, or to exceed human intelligence by collecting data. Now, we also talk about machine learning, and machine learning is a different thing. It's a technology that helps, that gives the system the ability to learn by themselves. So you build an algorithm that self-learn and bring a result that is embedded in the algorithm. So the machine is working on its own, not working under the control of an operator. And the machine brings back a result and gives you an outcome to help the physician, for example, decide if this exam is negative or not, automatically. And then deep learning is one step further, where we would use advanced techniques to do the machine learning based on the modelization of the human brain. So this is something that is totally aspirational, that nobody does today. In fact, if you look at the three elements, some of the players are in artificial intelligence. You've heard of IBM Watson. GE is investing in that game. Now, the journey is through artificial intelligence and through deep learning. So everybody understands what we are actually talking about. Now, when it comes to the space in which we play, I think we all understand that page. We're looking at volume and revenues in terms of disease. So we know what the biggest pathologies are in today's world. Whether we are pharma or diagnostic imaging, we're working on this, or we're working on this. The name of the game is to identify the pockets where it makes most sense to apply artificial intelligence. Now, when we look at what GE we are trying to do in this space, the idea is to build a portfolio of algorithms, and we don't know at this point in time. We are actually investigating with academias in the US, and we are starting to do it in Europe with private operators as well. We are trying to investigate what are the pathologies, what are the technologies that we want to invest in that makes most sense for the organization, starting with the radiologists, because this is our biggest client. And the idea here is to help operators lower the risk of negative consequences in the reporting of the exam. And in the end, because we're talking of this twin, to empower the people by removing the routine work and helping them focus on the specialized work and help people improve in their subspecialty, other than spending days to click on images that are simple enough to be treated by an algorithm. Now, I talked about BI at the beginning of this small pitch. Now, AI, as you see, about predictive modeling. You get into the prediction and the prescription, whether you look at the machine itself, the ecosystem, whether it's a diagnostic center or hospital, and long-term for the patient, treatment simulation, medication impact. What I'd like to say here is that there are words that are familiar to us: reimbursement optimization, treatment simulation, medication impact. These are things that we are talking about. They impact all actors in the space: payers, policymakers, pharma, diagnostic operators. So everybody is impacted by this. It's a medical play. It's also an economic play at the end of the day. So with that, I'd like to leave you with a testimonial from a client in the US, Johns Hopkins, with whom we've spent a number of months to develop a process to help them drive in real time and improve the process of their main facility in Baltimore from ED to patient recess. So I'll leave you with the words of an operator, and I'll be happy to answer any question during the next break or this afternoon. Thank you.
ERT, is this an emergency?
This is the Johns Hopkins Capacity Command Center, and the purpose of this center is really to help manage the flow of patients into and through the hospital. The idea first came about when we were talking about knocking a wall down between two groups that needed to talk to each other in order to make patient flow most efficient. And believe it or not, even though they needed to talk about every single patient, they would communicate through phones and faxes and emails rather than just be able to turn around and talk to each other. That's what's new and different here. It's not just the command center, it's an entirely different approach to managing day-to-day operation.
If you really think about it, 125 years ago in 1889 when we opened the hospital, the founding partners and fathers and mothers of this system were really here, groundbreaking, and created a new way of delivering healthcare. And I think we're doing that today with this. We're really setting the stage for the next 125 years of Johns Hopkins medicine.
What GE brings to the table is two things in a big way. It's their technology and taking and using our data to present information in ways that we have never historically been able to present it.
ERT, do you have a medical emergency?
And it's taking data and pulling it together and giving it to me in one picture snapshot to be able to help us with predictions and be able to manage information differently.
This whole center is really about patient and family-centered care. We can tailor their experience. There are a lot of people here in this center that work together. Previously, they were not able to share that information as quickly or as efficiently, and now we're able to do that at great speed.
We have to be able to manage the patients that need to be here. And so what this command center is all about, when all is said and done, is trying to maximize the number of patients who can have access to the incredible services that we provide here at Johns Hopkins.